Okay, thank you very much. I am Negash from Ambo University, and my research title is about predictors of maternal neonates in public hospitals of West Shoa zone, Central Ethiopia, which was addressed by a case control study design. And as introductions, maternal neonates is defined as mothers who nearly died but survived complications that occurred during pregnancy, intrapartum, or within 42 days of terminations of pregnancy. Um, these maternal neonates events are varied across the world, which is about 0.14% in developed world, while it can be about 12% in developing countries like sub-Saharan African countries, including Ethiopia. The major factors that makes this varied, the maternal needs make varied across the world is because of difference in social demographic characteristics, because of the difference in quality of obstetric cares in different regions, in different countries, including in Ethiopia. Despite the high maternal deaths in many of the health institutions of Ethiopia, the absolute number per each center is rare, which leads to the low power of the studies to investigate the potential predictors of the maternal neonates. Maternal neonates could serve as a surrogate for maternal death to evaluate the quality of obstetric care, particularly in health institutions. Since maternal mortality is a rare event, it's important to study maternal neonates as a complement to evaluate and improve the quality of obstetric care in each health facilities. Regarding the methodology, unmatched case control study was conducted among 664 mothers with 1 to 3 case to control ratio, with 166 cases and 498 controls from June to October 2019. Regarding the cases and the controls, we defined our cases as all patients with maternal neonates case admitted for delivery or treatment of pregnancy-related complications during the study period in 8 health facilities. And again, those cases, addition to that, were clinical criteria for severe maternal complications were also considered to define maternal neonates or severe maternal morbidity. Regarding to the controls, mothers who were admitted to the term of stars where the cases happened and delivered without complication or any severe pregnancy-related complications were considered as the controls. And then to enroll those controls, the simple random sampling techniques were employed to recruit them among eligible women. Regarding the data collection tools, a pre-tested and structured questionnaire were used. In addition to the pre-tested and structured questionnaires, we were also employed as of the checklists to collect certain variables. And regarding the analytical methods, both bivariable and multivariable logistic regressions were performed to identify significant predictors. When we come to result and discussion parts, about 5 variables like mother's occupations, level of education, admission and status, monthly income, and delays, particularly first and the second delays, were found to be the predictors of maternal neonates in multivariable logistic regressions. Now, let's see those variables one by one. The first variable that was found to be a predictor for maternal neonates were mother's educational status. The odds of maternal neonates among mothers who cannot read and write among mothers who had primary and secondary educations were higher compared to those mothers who had college and above. This means the probability to have maternal pneumonitis is decreased as mothers' educations are increased. This finding is aligned with the previous study conducted in different parts of Ethiopia and also supported by evidence from the studies of Brazil, Bolivia, and also Morocco. And again, the second variables that was found to be predictors of maternal pneumonitis were the mother's occupations. Actually, very difficult to say that is where in this study, being the students had a more likelihood of maternal pneumonitis compared to those who were housewives. We consider here being a student as the occupation because there were the study participants that mentioned their occupation as they are students. Why? Why being students are found to be a predictors is because this might be those where students are economically dependent on others, might be on their families or on other individuals for their school fee and the daily survival, which might make them to delays on decision making to seek healthcare. Once we are failed to decide in deciding to seek the healthcare, that can make them to have the first delays to seek healthcare. So that increases the probability to have maternal pneumonitis. The third variable was the admission status of the mothers. The also maternal pneumonitis among mothers who were unstable at admissions were higher compared to those mothers who were stable at admissions. The possible explanations are those who were unstable at admission might have undiagnosed severe maternal complications or developing the complication during the admissions. The fourth variables that found to be the predictors of maternal pneumonitis is monthly incomes. Mothers who had a monthly income of 500 to 2,000 Ethiopian birr were 90% less likely to have maternal pneumonitis compared to those mothers who had monthly income of less than 500 Ethiopian birr. This is because the socio-economic status of the mothers affects the access to reproductive health services, even after developing a maternal pneumonitis. And also, better monthly income are more likely to empower women and avoid delays in deciding to seek health care. That helps her to be out of that maternal pneumonitis. The last predictors of maternal pneumonitis that found in our study is delays. Particularly, the first and the second delays found to be the predictors of maternal pneumonitis in these studies. The odds of maternal pneumonitis among mothers who had first delay of greater than 6 hours were higher compared to those mothers who had first delay of less than 6 hours. This is in line with the previous study done in Ethiopia. This might be because of lack of awareness of pregnancy-related complications, which could be a protective factor for maternal pneumonitis. If a mother delay recognizing danger signs during pregnancy, childbirth, postpartum, and fail to decide to seek health care quickly, that may lead her to morbidity and mortality. And again, the second delay is also another predictor of maternal pneumonitis. The odds of maternal pneumonitis among mothers who had a second delay of greater than 60 minutes was higher compared to the mothers who had second delay of less than 30 minutes. This is consistent with the previous study in Ethiopia. This might be due to poor infrastructure and lack of transportation, leading the mother to delays in arriving to the health facility. That increases the probability of the severe maternal morbidity and the risk of maternal pneumonitis. In conclusion, mother's occupation, education, admission status, monthly income, delays, particularly first delay in decision making to seek health care. Secondly, delay in arriving to the health facility, particularly which might be linked to that of poor infrastructure, poor transportation systems, were found to be the predictors of maternal near misses in our state. In recommendation, the Federal Ministry of Health and other stakeholders should work on empowering the mothers to tackle the complications of a maternal near misses. Thank you very much